project is a three partnership. So it's Otago Polytechnic in Dunedin, New Zealand, 30 student nurses, with La Trobe Rural Health School in Victoria, Australia, with Mel and her colleague Kate, and we are focusing on the community, the rural community in the medieval village of Bishop's Castle in Shropshire, UK, which is on the English-Welsh border.
One of the best parts about this particular project is giving undergraduate students in Australia and New Zealand the opportunity to connect and develop networks and relationships with their peers on an international scale. So this piece of work, by creating a collaborative learning environment, will help the students, both cohorts, to improve their understanding of different cultures and the status of rural and remote healthcare around the globe, and foster ongoing global relationships and connections. So the opportunity to work internationally is a really valuable prospect for an undergraduate student. So having this piece of work funded and supported will ensure that it's high quality, and that also the students then develop a professional identity that sees them understanding themselves as a global health practitioner. From the La Trobe perspective, it's really exciting that we're going to have students across our 4 regional campuses. So we'll have students studying from Bendigo, Albury-Wodonga, Shepparton and Mildura engaged in this program. So that's a really unique I guess, component of this, is that we have students who are studying in rural communities. So in terms of the capacity and the impact that they will then in turn pass back to their community, we're really excited about this. And the other thing that we're excited about is for us to provide students with a learning opportunity that places mental health front and centre in terms of community context. So because of the status of our world and how we as humans are working at the moment, mental health is a significant issue. So to be able to provide students with the opportunity to really delve deeply into the impact and the presence and all of the issues around that at a community level is quite unique. And the other thing that's also really exciting about this is that this is providing an opportunity for rural students who wouldn't be able to engage in a mobility program because of financial constraints. So rather than limiting international opportunities, we're actually fostering and creating a way of learning through this internationalisation at home approach. I find that really exciting.
Yeah, I agree as well. It's an opportunity that we might never have thought about, and so we're grateful to the foundation, to the grant that we've got, and to be very innovative in it as well. And unlike maybe the other projects, this project is a building of a 3-year relationship, and a relationship with us and La Trobe, which is another exciting thing, isn't it, Mel? That's going from strength to strength. Yeah.
It is, and that's where the opportunity for to link in with the network and to be able to potentially use this as an exemplar as to the possibilities that can be supported is definitely welcomed. And I think that the other thing is, by encouraging our students to develop those strong relationships with their peers across the globe, we're positioning registered nurses to understand that part of their role is connecting upwards and outwards with others on a global scale, and that will no doubt lead to a lot of collaborative work in rural communities across many countries, hopefully.